Hari Om. I'm Devika Bhide from YogaPoint India. Welcome to 7th session of YCB Yoga Wellness Instructors course. In today's session, we are going to practice Bandha, then sectional breathing and few techniques of Pranayam. So let's begin. What is Bandha? Bandha is given very significant importance in Hatha Yoga. Difference in Bandha and Mudras is that Mudra energizes your whole body, creates circuits of energy and restores 5 elements. But Bandha, which are generally practiced during Pranayam or in asanas also, involves contraction of muscles and accumulation of energy or prana at particular plexus or chakra of our body. So in our syllabus, we have total 3 bandhas: Jalandhar Bandha, Moolah Bandha and Uttayan Bandha. Please note that these bandhas are just for demonstration and they are not for teaching. But questions can be asked on application of knowledge section. So let's begin. First, let's practice Jalandhar Bandha. To practice it, first sit in any meditative pose, preferably Padmasan or Swastikasan, Siddhasan. Keep your hands in Dhyana Mudra over your knees, spine tall and straight, erect, and gaze forward. After sitting in this pose, slowly close your eyes and inhale. Inhale as deep as you can, and after inhaling, hold that breath in. Perform Antarkumbhak. To practice this, first inhale, and after inhaling, slowly bend your neck forward in such a way that your chin should touch end of your throat. Do not put excess pressure or strain on your neck. Be gentle with this. Consider your neck as in spring, bend it forward and hold for as long as you can. Retain the breath inside. Do not exhale while Bandha is performed. After holding it for a few seconds, whenever you feel like exhaling, slowly straighten your knee, take it back to initial position, starting position, and then gradually exhale. Exhalations should be slow, smooth and long. Benefits of Jalandhar Bandha. Jalandhar Bandha is practiced by bending our neck forward and touching our chin at the end of our throat. So which stimulates carotid sinus, carotid artery, which keeps sending messages to our brain. When this sinus is stimulated, it sends message to the brain and brain lowers down our BP. Due to lowering down the BP, our heart rates goes down, nerves and body feel more relaxed and quiet. This gives energy, prevents aging and also cures minor throat related problems. Jalandhar Bandha stretches your cervical spine and your spine, which helps to make your spine flexible and function well. While practicing pranayam, when we perform kumbhak, the air which is retained in try to exit through various passages. So that is why it may go towards your ears or eyes. But when you practice Jalandhar Bandha, the air is blocked at the end of your throat, and it helps or prevents the air to go towards your eyes or ears. Just make sure that do not exhale when you have attained the Bandha. Contraindications of Jalandhar Bandha. Person who is suffering from throat related problem or high blood pressure or low blood pressure or has undergone or recovering from any kind of surgeries, injuries should not practice this bandha or should practice under expert guidance. Next bandha is Uttayan Bandha. In Uttayan Bandha, we pull our abdominal muscles, our navel and diaphragm in and upwards. Maybe that is why it is known as Uttayan Bandha. This bandha can be practiced in sitting pose or in standing pose, but for beginners it is recommended to practice in standing pose. So let's learn it in standing position. Please stand straight on your mat with your legs together, back straight and gaze forward. Then take shoulder distance in your legs, take comfortable distance and keep equal weight on your legs. Slowly bend your knees, place your right palm over your right knee, left palm over your left knee and tilt your chest and your neck little forward to avoid excess pressure over your abdomen. After attaining this position, we will exhale completely and apply the bandha. So please make sure or note that we are going to practice this bandha with Bahya Kumbhak. You exhale and then practice. In Jalandhar Bandha, we inhaled and then applied Bandha. So to practice Uttayan Bandha, first you bend forward, exhale completely, and then pull your navel, your abdominal muscles or your diaphragm in direction of your spine and upwards. So in and up. Pull your muscles in as much as you can. Hold this position tight. Engage your muscles. Hold it. And if you feel like breathing in, slowly relax your muscles. Go back to initial position and then gradually inhale. This inhalation should be very slow and smooth. You can repeat this process 5 to 6 times. Exhale, pull your muscles in and up, hold, and whenever you feel like breathing in, slowly relax your muscles and then inhale. After doing this for a few times, slowly stand up and go back to standing pose. Benefits of Uttayan Bandha. When you apply Uttayan Bandha, you exhale and pull your muscles in, abdominal muscles in, which create negative pressure inside your belly. This facilitates more blood circulation to your intestine, pancreas, your abdomen, liver, spleen, kidneys, and improves overall functioning of your digestive and excretory system. It also stimulates digestive juices, increases your appetite, and gives your diaphragm good massage. It also increases capacity of your lungs because when you inhale and pull your muscles in, your chest widens. This bandha also has spiritual benefits. It helps in awakening of Kundalini Shakti, and it also stimulates your Manipur chakra, solar plexus. Contraindications of Uttayan Bandha. If you are suffering from hernia, constipation, piles, if you have BP problem, high BP or low BP, or if you are recovering from any kind of surgeries, injuries, then please avoid this bandha. Next bandha is Moolah Bandha. Moolah Bandha stimulates your Mooladhara chakra, that is why it is known as Moolah Bandha. It involves muscles of your anus and muscles around your anus. So while practicing this bandha, first you sit in meditative pose, preferably Siddhasan, where you sit over your heels. But for this syllabus, you can sit in Padmasan to practice this bandha. So sit in Padmasan, keep your spine straight, your hands in Dhyana Mudra over your knees and close your eyes. Then inhale, practice Antar Kumbhak. Inhale, and after inhaling, pull muscles of your anus and muscles around in upward direction towards your abdomen. Hold those muscles tight and don't breathe. Retain your breath. After holding it for a few seconds, whenever you will feel like inhaling, first relax your Moolah Bandha, relax your muscles, and then slowly exhale. This exhalation should be slow and smooth. Do not force, do not struggle. Practice as per your capacity. Benefits of Moolah Bandha. While practicing Moolah Bandha, we engage our muscles of our anus and muscles around our anus, which makes those muscles flexible and strong, facilitates more blood supply to our perineum. When we practice pranayam for longer duration, blood gets accumulated at our waist. So with help of Moolah Bandha, blood keeps circulating all over our body and does not get accumulated. Moolah Bandha prevents aging. It stimulates Kundalini Shakti, stimulates Mooladhara Chakra, and also directs flow of Apana Vayu upwards. As per text, it is also said that Moolah Bandha reverses our age or prevents aging. Contraindications of Moolah Bandha. If Moolah Bandha not performed properly can affect our digestive system, and that is why people suffering from hernia, piles, digestive system related problem should not practice this bandha. So we have covered all three bandhas, Jalandhar Bandha, Uttayan Bandha and Moolah Bandha. Now let's practice next part, that is of sectional breathing. What is sectional breathing? This breathing is done in sections, 3 sections: abdominal breathing, thoracic breathing and calvicular breathing, and that is why it is known as sectional breathing. When we start practicing this breathing, first we practice each part individually. For example, first we will practice few rounds of abdominal breathing. We will focus only on our belly. Then we will practice thoracic breathing, where we will breathe from our chest, lower part of our chest and middle part of our chest. And then Calvicular Breathing, where we will breathe from upper part of our chest and our collarbones or shoulder area. So this is how we will breathe in sections. And after doing this or practicing this individually, we will practice all three simultaneously, which is known as complete yogic breathing. So we first start breathing through abdomen, then chest, and then calvicular region. And we exhale from calvicular region, first from calvicular region, then chest region, and then abdomen. So this is how we complete one cycle of sectional breathing. So first, let's understand how to practice it. Please sit in Vajrasan, keep your back straight and eyes gently closed. While practicing sectional breathing, we are going to use different three mudras. So let's see. First, sit in Vajrasan, keep your back straight and eyes gently closed. First, we will practice abdominal breathing. Perform chin mudra of your hands. Touch tip of your thumb and your index fingers together and place your hands in downward direction over your thighs, at the middle of your thighs, in comfortable pose. Keep your back straight and now gently close your eyes. Now let's begin. First, just pay attention to your belly. When you inhale, your diaphragm goes down. So your belly comes out, even your chest comes out. So pay attention to correct breathing. Inhale and let your belly expand like a balloon. Then slowly exhale, let your belly fall. Again inhale, let it rise. Exhale, let it fall. Like this, keep breathing. Abdominal breathing. Initially you can place your palm over your belly to notice your breathing pattern or movement of your diaphragm. Keep your mind calm and be effortless. Do not force. Okay, now slowly exhale and open your eyes. Now next part is thoracic breathing, where we will breathe from our lower and middle chest or upper chest as well. So practice Chinmay Mudra of your hands. Touch your thumb and index fingers together and slowly bend your remaining three fingers down. Place your hand, this is Chinmay Mudra. Place your hands in downward direction over your thighs, in the middle of your thighs. Keep your back straight and eyes gently closed. So let's practice thoracic breathing. Now don't let your abdomen move, but inhale and exhale through your chest. So as you inhale, let your chest expand, open up your ribs sideways. Fill your lungs as much as you can, gradually, slowly, and exhale. Let your chest fall. Keep breathing this way. Let your chest rise sideways. Fill your lungs gradually. Breathing should be effortless. And exhale. Keep breathing. Practice few rounds of thoracic breathing. After practicing few rounds, slowly exhale and open your eyes. So we practiced thoracic breathing from our chest with Chinmay Mudra. Now let's practice calvicular breathing, upper chest and your shoulders or collarbones. While practicing this type of sectional breathing, we will practice Adi Mudra, in which you have to tuck your thumbs in and make fist around your other fingers, around your thumb, and place your fists in downward direction over your thighs. Sit in Vajrasan, keep your back straight and gently close your eyes. Now pay attention at the upper region of your chest. As you inhale, your collarbones will go up, and as you exhale, they will fall. Don't do it deliberately. Do not forcefully lift your shoulders up. Let it be very natural. Just focus on upper part of your chest and keep breathing. Breathe for a few seconds. Make sure your hands are in Adi Mudra. Don't let your belly or chest move. Little movement is okay. Let's practice few rounds. Then slowly exhale and open your eyes. So this was Calvicular Breathing. So first we practice abdominal breathing with Chin Mudra, then thoracic breathing with Chinmay Mudra, then calvicular breathing with Adi Mudra, and now we will practice full yogic breathing, where we will practice all three sections simultaneously. So let's practice. Sit in Vajrasan and hold your hands in Brahma Mudra. Tuck your thumbs in, round your fingers around your thumb, and place your knuckles in such a way that they will be touching each other below your navel, over your thighs. Brahma Mudra. Keep your back straight, your knuckles are touching each other. This way. Place your hand below your navel and start breathing. Full yogic breathing. First, when you will inhale, first fill your abdomen with air, then your chest, let it move upwards, and then fill your lungs, upper area of your chest. While exhaling, go in reverse direction. First exhale through your calvicular region, then thoracic region, and then abdominal region. Again, inhale, continue breathing, full yogic breathing. Keep your all muscles loose and relaxed. Notice movement of your diaphragm. Use your entire lungs. Fill air at all parts of your lungs. Lower part, upper part, side area, your belly. And let it be very, very natural. Do not struggle, do not force. Continue few rounds. Full yogic breathing. Now slowly exhale, complete your round. And when you are ready, slowly open your eyes. Sit in comfortable pose. So this is how we practice sectional breathing. First we practiced abdominal breathing, then thoracic breathing, then calvicular breathing, and then full yogic breathing. All three sections simultaneously together. Note that sectional breathing is just for demonstration, not for teaching part. Benefits of sectional breathing. Generally when we breathe or we use very little part of our lungs, maybe middle part of our chest. But sectional breathing allows us to use full capacity of our lungs. Lower region, middle region and upper region. This prevents minor respiratory problems or diseases, gives you more oxygen, increases capacity of our lungs. This facilitates more oxygen in your blood, which purifies your blood, improves your overall health and immunity. And it also helps you to breathe correctly. When you inhale, your chest and belly goes out, and when you exhale, they fall in. So this is how you practice sectional breathing. Sectional breathing prepares you for the practice of pranayam. Contraindications of sectional breathing. Let your breath be very, very natural. You can sit in any comfortable position. Do not force. Breathing should be slow and smooth without giving jerks. And always practice as per your capacity. Now we are done with sectional breathing, which is just for demonstration, not for teaching. Now let's move to next part, which is of pranayam. What is pranayam? So Patanjali defines pranayam as tasmin sati shwasa prashwasa yoho gati vichhedaha pranayamaha. Tasmin sati, after practice of asanas or after being comfortable with asanas, we practice pranayam. So you don't have to skip any part. First you practice third step of Ashtanga Yoga and then go to fourth step. Tasmin sati shwasa prashwasa yoho gati vichhedaha. Gati, intersection of speed of inhalation and exhalation, is pranayam. So this intersection is done in specific manner. Just inhalation and exhalation and gap between inhalation and exhalation is not pranayam. But when you intersect speed of inhalation and exhalation in specific manner, maybe by practicing kumbhaka, that is known as pranayam. So in our syllabus, we have total 5 techniques of pranayam, but we are going to practice them just like any other breathing technique, because we don't have kumbhak or bandha. We are not going to apply bandha while practicing pranayam. So let's understand which techniques we have. We have Nadi Shuddhi, which is also known as Anulom Vilom. Then Brahmari Pranayam, Ujjayi Pranayam, Shitali Pranayam, and Sitkari Pranayam. So there are total 5 techniques. Let's understand them one by one. Before we begin, please note that pranayam is for demonstration as well as for teaching and for application of knowledge. So practice, study pranayam well. In exam, in demonstration section, you will be asked to demonstrate any pranayam, which you have to just practice pranayam and release it as per examiner's instructions, always from your left nostril. So complete your cycle, exhale from your left nostril and stop. If you are practicing it with Pranava Mudra. Then for teaching part, now you will be given 3 to 5 minutes for teaching. So in exam, you have to give introduction of pranayam, you have to tell how to practice it, its duration, tell examiners that we are going to practice it without kumbhak. You can tell ratio of your breathing pattern, and then benefits and contraindications. You don't have to demonstrate it or get it done from the students. So let's begin with pranayam practice. First technique is Anulom Vilom or Nadi Shuddhi Pranayam. So in teaching part, you are going to teach your students. So we always start pranayam after practicing normal breathing, fast breathing, or after preparing for it. So first give instructions of preparation. Those instructions should be really quick. Like after practicing Kapalabhati, deep breathing, fast breathing, normal breathing, now let's learn Nadi Shuddhi Pranayam, because preparation is very, very important. So let's focus on Nadi Shuddhi Pranayam. Nadi Shuddhi is not a type of pranayam, or it is not given in Ashta Kumbhakas, which are given in Ghiranda Sahita and Hata Pradipika. But this Nadi Shuddhi is referred in Hata Pradipika as a Shuddhi Kriya. So we can also say that Nadi Shuddhi is a Kriya. Nadi Shuddhi involves alternate nostril breathing. So it removes blockages from your nadis, allow free flow of prana shakti, and also engages or makes your right and left brain active. To practice Nadi Shuddhi, first you sit in Padmasana, keep your back straight, hands in Dhyana Mudra and eyes closed. Then hold your right hand in Pranav Mudra. Bend your middle finger and your index finger. Place your right thumb over your right nostril and your ring finger over your left nostril. Start inhaling from your left nostril. So first inhale through your left nostril, then close your nostril, open your right nostril and exhale through right. Then again inhale through right and exhale through left. Keep repeating this for few cycles. You can practice 10 to 15 cycles, alternate nostril breathing. Always start from left side and end at left side. After practicing it for few rounds, you can release Pranav Mudra and hold Dhyana Mudra with your right hand over your knee. Now, while practicing Nadi Shuddhi Pranayam, its duration can be that you can start with 10 repetitions or 15 repetitions, and then you can practice it up to 20 minutes or half hour, or as per your wish, as long as you can. While practicing this pranayam in our exam, we are going to practice it without kumbhak, and ratio of your breath should be 1:2. So you inhale in 1 count and exhale in 2, or inhale in 4 counts and exhale in 8 as per your capacity. Benefits of Nadi Shuddhi. Nadi Shuddhi involves alternate nostril breathing. So it removes blockages from your both nadis, allow free flow of prana shakti. It also balances right and left side of your brain. It cools down, calms down your mind. It helps you to fight with stress, depression, anxiety, and other mind related problems. It also induces more oxygen in your blood, which purifies your blood, improves your overall immunity and health. It helps you to cure minor heart related problems. Nadi Shuddhi is very good for diabetes patients. It is also good for those who are suffering from migraine, headache, insomnia, asthma, and other neurological problems. Nadi Shuddhi involves alternate nostril breathing, so it effectively removes all your carbon and toxins out. Precautions and contraindications of Nadi Shuddhi. Any kind of pranayam should ideally be practiced in fresh air and with empty stomach. Those suffering from heart diseases or abdominal surgeries, any kind of surgeries, injuries, should practice it under expert guidance. It is said that pranayam, when done correctly, can cure all the diseases, but when done incorrectly, can invite all sort of diseases. And that is why young children, elderly, and pregnant women should practice pranayam, any kind of pranayam, under expert guidance. People suffering from heart surgery, brain surgery, abdominal surgery, or any kind of surgery and injury should avoid practicing pranayam or practice under expert guidance. Always remember that practice pranayam as per your capacity. Inhalation and exhalation should be very, very smooth and slow. Do not struggle, do not exert your diaphragm or any other muscle of your chest. Ujjayi Pranayama, victorious breath. So after practicing or preparing our body for pranayam, after practicing Kapalbhati, deep breathing, fast breathing, now we will learn Ujjayi Pranayam. Ujjayi means victorious breath. So in Sanskrit, Ut means superior and Jai means conqueror. So when we practice this pranayam slowly and smoothly, our chest expands like a proud conqueror. That is why it is known as Ujjayi Pranayam. This pranayam is really good for our thyroid and it generates heat at our throat. So to practice Ujjayi Pranayam, first sit in any meditative pose, preferably Padmasana. Keep your hands in Dhyana Mudra and your back should be erect. Body completely loose and relaxed, and gently close your eyes. To practice this, first we will inhale through our both nostrils and we are going to exhale just from our left nostril. So first to inhale with your both nostrils. While inhaling, contract muscles at the end of your throat, your glottis, and make hissing sound. So inhale by contracting your glottis, making hissing sound. And while exhaling, apply Pranav Mudra. Bend your middle finger, your index finger, place your thumb over your right nostril and your ring finger on left. Just open your left nostril and while making hissing sound and while contracting your glottis, you exhale. I hope you can hear this sound. Please try to listen. First inhale with your both nostrils. Exhale through left. Practice few repetitions of Ujjayi, and then slowly release your, first exhale through your left nostril, slowly release your Pranam Mudra. Take Dhyana Mudra with your right hand and then slowly open your eyes. So this is how you practice Ujjayi Pranayam. Ratio of your breathing should be 1:2. Inhale in 1 count, exhale in 2, or inhale in 2 counts, exhale in 4, as per your capacity. We are not going to practice Kumbhaka, so this pranayam will be Kumbhak Rahit or without Kumbhak, just for our syllabus or for this exam. Duration of Ujjayi Pranayam can be, so you can start by practicing 10 repetitions, 15 repetitions, and then you can go on increasing this time up to 10 minutes, 20 minutes or more as per your capacity. Benefits of Ujjayi Pranayam. So when you practice Ujjayi Pranayam, it creates heat inside your throat. So it helps you to fight with asthma, cold or bile, phlegm or wind at your throat. Helps you to remove blockages inside your nadis, allow free flow of prana shakti. It also stimulates your lungs and your digestive system, so it helps you to cure or tackle indigestion, treats minor lungs related problems. It also stimulates your thyroid. It is very significant benefit of Ujjayi Pranayam that it strengthens your vocal cords, it stimulates your thyroid gland. Then it also helps you to tackle with migraine and insomnia. Contraindications and precautions. As I have said earlier, that practice any pranayam in fresh air and empty stomach. People suffering from heart related problems should avoid practicing Ujjayi Pranayam. And beginners, children and elderly people should practice under expert guidance. Brahmari Pranayam, humming bee breath. So, after preparing ourselves for pranayam practice, after practicing Kapalbhati, deep breathing, normal breathing, fast breathing, now let's learn Brahmari Pranayam. Brahmara in Sanskrit means humming bee, Brahmari. So when we practice this pranayam, we create sound like humming bee. That is why it is known as Brahmari. It is very good for our vocal cavities and it also induces calmer alpha waves inside your brain. To practice Brahmari, first sit in any meditative pose, preferably Padmasana. Keep your hands in Dhyana Mudra, back erect and eyes gently closed. Please note that in our syllabus, we are not going to perform Shanmukhi Mudra while practicing Brahmari, but we will just keep our hands in Dhyana Mudra. To practice Brahmari, first we will inhale through our both nostrils. Breathing or inhalation should be normal inhalation. So you inhale through your both nostrils as deep as you can, and while exhaling, contract muscles at or around your vocal box, your soft palate, and exhale while making humming bee sound through your throat and your nose. So this is how you exhale, which is known as Brahmari exhalation. So to begin with, or in first round of Brahmari, you inhale normally through your both nostrils and you exhale Brahmari exhalation by making humming bee sound. Then on second round of Brahmari, you contract muscles around your vocal box and your soft palate and inhale with contracted muscles. So this is known as Brahmara inhalation. Brahmara means male humming bee and Brahmari is female humming bee. So when you inhale by contracting your muscles around your vocal box, it makes sound of male humming bee, which is known as Brahmara inhalation, and while exhaling you will make sound of female humming bee, which is known as Brahmari exhalation. So from second round onward, you will practice Brahmari inhalation and Brahmari inhalation. Only first round is normal inhalation and Brahmari exhalation. So let's practice this together. Again, close your eyes, keep your hands in Dhyana Mudra and practice. Normal inhalation, Brahmari exhalation. Brahmara inhalation, Brahmari exhalation. inhalation. Brahmari exhalation. Practice few rounds of Brahmari inhalation and Brahmari inhalation. 10 rounds, 15 rounds, then you can go on increasing this duration up to 10 minutes, 20 minutes or more. Inhalation and exhalation should be in 1:2 ratio, and we are going to practice it without kumbhak for our exam. So after practicing, you exhale Brahmari exhalation and then slowly open your eyes. This is how you practice Brahmari. Benefits of Brahmari Pranayam. Brahmari Pranayam soothes your voice, it improves quality of your voice and speech, relaxes nerves around your neck, tones your muscles. It induces calmer waves inside your brain, so it helps you to tackle with stress, depression, anxiety, increases your focus, concentration, also helps you to control high blood pressure, tackles insomnia, and it is very good for pregnant women. But they should practice it under expert guidance. So that's it for today. In today's session, we practice 3 bandhas, sectional breathing, and 3 techniques of pranayam. Shitali and Sitkari are remaining. We will practice them in next session. Keep practicing. Hari Om.